Welcome to On the Ballot with Ballotpedia, where we take a closer look at the top political stories of the day. Ballotpedia connects people to politics by providing neutral, nonpartisan, and reliable information on our government, how it works, and where it's headed. I'm Frank Festa. Thanks for being with us. Today, I'm joined by BP policy staff writer John Dunn to help us better understand the legislative trends regarding work requirements for public assistance programs, the arguments for and against them, and what we might expect as the year progresses. John, thanks for coming on the show.
Yeah, thanks for having me here. I appreciate this opportunity.
Of course. So when it comes to work requirements for public assistance programs, there are four main categories that Ballotpedia covers: Medicaid, SNAP, which is formerly known as food stamps, public housing, and childcare. They all operate a little bit differently. So, John, can you give us a brief overview of each?
Yes, exactly. But before we get into the differences, let's talk about some of the similarities. So when we're talking about work requirements, these are mandated work-related activities. So obviously employment, but can also include various other activities, including job training, community service, and education. And then public assistance, these are social welfare programs. And as you mentioned, there's four types. These programs are federally funded and operate under federal guidelines. They are administered by the states, and states can and do run them a little bit differently.
Cool, I got you. So how about a little bit more about each? Why don't we start with SNAP?
Yeah, so SNAP stands for the Supplemental Nutrition Assistance Program. And as you mentioned, it's formerly known and it is still commonly referred to as food stamps. Mm-hmm. This is run by the Department of Agriculture. And these have two categories of work requirements. For the general work requirement, it's 30 hours per week. And then there's a second work requirement for able-bodied adults without dependents. And they can work, volunteer, and do job training for 20 hours a week. And so these are the same across the board. All states have these work requirements. The next one is Medicaid. So Section 1115 of the Social Security Act allows states to apply to the Centers for Medicare and Medicaid Services for approval to develop experimental or pilot state-level programs, including work requirement programs. So there's a recent history of states applying for these Section 1115 work requirements, but then getting rejected by the Centers for Medicare and Medicaid Services for running contrary to the objectives of that program. So currently only Georgia has a work requirement.
Good.
And then for public housing, this is administered by the Department of Housing and Urban Development. So public housing authorities can apply to Moving to Work demonstration program, which allows public housing authorities to design strategies to increase public housing efficiency. They can try to reduce costs or expand housing options. This allows innovation and flexibility across the approximately 3,300 PHAs in this country. So of those 3,300, only 124 are part of the Moving to Work program. And again, only 17 of those programs have work requirements. And then last, we have public assistance programs for childcare subsidies. And there are two types. And this is the Child Care and Development Fund, which is the primary funding of childcare subsidies, and then also the temporary assistance for needy families. So these are run by the Department of Health and Human Services. So for the CCDF, 25 states currently have mandated work requirements, so about half the states. And then for TANF, it is across the board. There's a federal requirement for all 50 states to work 30 hours per week for one parent and 55 hours for two parents. And of course, this is all way more complicated than I can summarize in this podcast. So I would encourage anyone, if they're interested, to go to and do some more research at Ballotpedia.
Yeah, definitely a great summary there, John. But as you mentioned, a lot of information for listeners. If you want to learn more, we do have a link for these programs in our show notes. Before our interview, you sent over a few of the recent policies and proposals you've been following related to work requirements for public assistance programs around the country. Can you run through a couple you found most interesting or noteworthy to give our listeners a sense of what's being proposed and passed or rejected around the country?
Yes, absolutely. So the most substantial reform that's happened in recent years is that there are new federal SNAP work requirements. So as part of the negotiations for the Fiscal Responsibility Act that was signed last year, this added new work requirements for older Americans while simultaneously removing some work requirements for veterans, homeless individuals, and former foster children under age 25. So these new work requirements roll out in three phases. The first increased the age to meet work requirements from 49 to age 50, and the second increased it to age 52. And so both of these phases have already happened. And then the next phase is going to roll out next year, and it's going to increase the age to meet work requirements to 54. So the other noteworthy reform that happened was Arkansas passed some new public housing work requirements. So this requires able-bodied adults to work volunteer, or participate in a work training program for at least 20 hours per week. So if these work requirements are unmet, then the law requires the PHAs to terminate the lease agreements after 60 days. The law requires local public housing authorities to seek approval from the Department of Housing and Urban Development to implement these work programs. So we'll see what happens with that. These PHAs are not part of the Moving to Work demonstration program. So
yeah, a lot of this stuff is we just have to wait and see, right?
Yeah, definitely.
Would you say that work requirements are generally trending in one direction or another, or is it more of a mixed bag?
Yeah. So although you do see some states attempting to pass work requirements, my better judgment tells me that most of these aren't going to go anywhere just because of the policies that are set up and the guidelines that they have to operate under. So states must operate under the federal rules and guidelines. And under the current administration, you're not going to see a lot of action. There is an election coming up this year, as you know, so we'll just have to wait and see what happens. And I do want to note that former President Trump signed an executive order in 2018 to increase work requirements for public assistance. And I think that it encouraged some of the conservative states to move forward on these programs.
What sort of similarities are you noticing, John, behind some of these reforms? Are there themes that are emerging?
Yeah. So although we do have a lot of differences across these 4 types of public assistance programs, and it's also varied approaches on how the states decide to administer these programs, there are a few similarities. So one is on who is required to meet these requirements. So most of these requirements are directed at able-bodied people, so generally without young children who are required to work. So, and also most of these work requirements do not include individuals with disabilities or elderly people, children, pregnant women, or families with young children. And so the other type of similarity we're seeing is that they're expanding work-related activities. So what qualifies as work, as eligible or qualified activities to include more types of activities. So you see programs now accepting job searching, job training, applying for a job or interviewing, as well as volunteering or community service, sometimes education. And then some programs also allow health treatment.
Are there any bills in particular or trends or states maybe that are worth keeping an eye on for new rules and regulations over the course of this year?
Yeah, so there are several reforms happening at the state level related to Medicaid work requirements. So right now there are some legal changes surrounding Georgia's Medicaid expansion work requirement. So the Georgia Pathways to Coverage, that's the name of their Medicaid program, is an experimental expansion program. It was first approved by the Trump administration and requires enrollees to participate in 80 hours per month of work, education, job training, or community service. The Centers for Medicare and Medicaid Services later rescinded approval of the program under the current Biden administration due to the work requirements. Later, a federal court ruled in Georgia's favor in 2022, and the state did not get the program running until 2023. So they applied to have their program extended, arguing that the legal complications delayed them. And the Centers for Medicare and Medicaid Services rejected that, and Georgia has now sued them in court. So we'll see what happens with that, if that program will be extended or not. Also, Kansas is seeking to expand Medicaid with work requirements. So Governor Laura Kelly there is attempting to use work requirements as a way to expand Medicaid. And Kansas is one of only 10 states that has not expanded Medicaid. So all the 40 other states have expanded Medicaid. So, and then finally, we're seeing that Ohio is seeking to expand work requirements for Medicaid. So Governor Mike DeWine signed a 2-year state budget last summer that seeks to implement work requirements for Medicaid recipients. So this requires Ohio Department of Medicaid to apply for a Section 1115 waiver from the Centers for Medicare and Medicaid Services. We'll see what happens with that.
Nice. A lot of stuff going on here. Thank you so much for bringing us up to speed, John. We'll definitely have to have you back on the show.
Yeah, this was informative. Thank you so much for having me.
Of course. And for our listeners, you can learn more about work requirements for public assistance programs at the link in our show notes. We'll be back with more on the ballot next week. Make sure you subscribe wherever you listen to podcasts. I'm Frank Festa, and thanks for listening.